I am Jimmy Evans, and this is Barbershop Therapy. We cut through the problems. Welcome to Barbershop Therapy, and I'm Jimmy Evans, your host, and I'm here today with an honored guest, Dr. Ari Isaacson. He is a interventional radiology.
You got it. You nailed it. Interventional radiologist.
And this specialty is something that deals with the prostate. And so we're here today to talk about how the prostate definitely affects men of color, stats that come along with that to kind of see how we can help out people possibly thinking about this and using this procedure as an alternative to other more invasive procedures. So, Dr. Isaacson, thank you for being here.
Thanks for having me.
Good. So, first of all, can you kind of tell us a little bit about yourself and your story and how you got here?
Sure. Yeah. So when I was in medical school, I wanted to be, I thought I wanted to be a surgeon. I wanted to do operations, and I was more about using my hands than kind of seeing patients every day in clinic. And so I decided to pursue surgery, but then I realized that maybe that lifestyle, the surgery lifestyle, wasn't really for me. So I was looking for a specialty where I could do procedures, but they were a little more short-term and allowed for a little better lifestyle. And so I found out about interventional radiology, which is a subspecialty of radiology. And the reason it's a subspecialty of radiology is because we use imaging. So when we do our procedures, we always have a screen showing us something, whether it's X-ray or CAT scan or ultrasound, and that's how we do our procedures. And so I found this specialty and ended up training right here at the University of North Carolina. And then I was on faculty there for a while. And during that time, I started doing research. And one of the things that I was researching was this procedure, prostatic artery embolization, to help reduce the size of enlarged prostates. And fortunately, that procedure turned out to be a really good one. And now, in my current practice, that's mainly all I do is that specific procedure.
Okay, so you now focus on PAEs primarily throughout your whole entire practice is what I'm hearing you say, right?
That's right.
Okay, so leading into enlarged prostates, which is known as BPH, a lot of African American men suffer from that. Can you tell us what are some of the parameters around a good candidate that would kind of ease a person's mind to know about this procedure?
Yeah, so anyone who has an enlarged prostate that is causing difficulty with urination, and really those two factors are really the main things. Because it's such a minimally invasive procedure, we can treat patients who otherwise may not be good candidates for other surgeries. If they have other problems such as heart disease or lung disease, we can still treat them. If they're on blood thinners, we can still treat them. And so one thing about our procedure, though, is it's particularly good with really big prostates. So the bigger the prostate, kind of the better result we tend to get. And so that's another kind of advantage of this procedure is instead of a lot of times men who have really big prostates have to go and have a pretty extensive surgery, but instead they can come and have this procedure, which is minimally invasive, and still get the same type of outcome.
Okay, so what are some of the other types of surgeries that they may have that are more invasive, and what would disqualify them from having this procedure if they've had other procedures?
Yeah. So the other procedures that are out there, they range, and they kind of depend on the size of the prostate, right? So if you have a just mildly enlarged prostate, there's about 3 to 5 procedures. They range from the standard TURP procedure, TURP, which is also affectionately known as the Roto-Rooter procedure.
Oh.
You can kind of imagine why it has that name.
Yes, sir.
And there's variations of it where different instruments are used to kind of clear out a channel within the prostate. But all those, they tend to go through the penis and they treat the prostate that way.
Ouch.
Yeah, exactly. And then once you get to the bigger sizes, now you have to use a more powerful laser to treat the prostate. Okay. Or you actually have to have a surgery where they remove the prostate altogether.
So when before removing the prostate, using the laser procedure, so essentially you're just going in, cleaning out, vacuuming out that dead tissue and bringing it out. Could you kind of relay that in layman terms so
Sure.
people, that may not be
Yeah,
familiar with the
yeah.
procedure, what that entails?
Yeah, so, pardon the details, but that's how
Yeah.
what we got to do. So the laser procedure also goes through the penis, and it puts an instrument through there that has a camera on it and also has a laser. And using the camera, you can see where the prostate is, and using the laser, you break up the tissue, like you were saying, and then suction it out. And so you're just creating a big channel in there so that the urine can now come out from the bladder through the penis. And so that would be a laser procedure. And then the actual removal of the prostate is usually done through multiple holes in the abdomen. And the most common way these days to do it is using a robot. It's robotic assisted. So a robot helps move the instruments so that it can be more precise.
Okay.
And that's how most of the time, that's how the prostate's removed.
Okay, so now we're talking about, we've talked about the requirements, we've talked about possible things, speak more about possible things that would disqualify a person from having that procedure.
Yeah. So the things that we ask about are if someone has what we call bad vascular disease. So who might have that? It's people who have been uncontrolled diabetics for a long period of time, so their sugars have been high, and that causes them to have a lot of calcification in the arteries. Also, people who are longtime smokers will have a similar effect where the arteries will be calcified and narrowed, and that makes it really difficult for me to navigate my catheters through the arteries to get where I need to go.
Okay.
And then also patients who have pretty severe renal dysfunction, so that's kidney problems, really severe kidney problems. They might not be able to have the contrast dye that we use in this procedure, and so that's another reason that a patient might not be able to have it.
Okay. So moving on to the idea of the benefits of this procedure, and clearly it's minimal invasive. That's one of the main reasons that you chose to go into it. Are there any statistics or numbers that you have that could kind of show from a race or ethnic perspective how helpful this would be to men of color?
Yeah. So I don't know the exact number, but I do know that BPH and enlarged prostate is more common in people of African descent, as well as the actual prostate size tends to be bigger when we treat them. We see that also in women with fibroids. It's very similar. Women, African American women, tend to have, or more commonly have, large fibroids in their uterus, and there's a similar procedure that I do for that as well. It's considering what I said before about the procedure being more effective for larger prostates. Those bigger prostates tend to do very well with the PAE.
Okay, and so in figuring out when we were working through those benefits, the imaging that you refer to. So if say for instance, an individual will come to you and they have images and they're showing prostate size, can you give us an idea of prostate size that says great candidate, not a great candidate?
Yeah. So the prostate, when it's normal, is about the size of an almond, okay, or a walnut rather. Sorry, a walnut. I got my nuts mixed up. So a walnut, you can imagine, about this big. As it gets enlarged, it's mildly enlarged. You may say, well, now it's kind of the size of maybe a ping pong ball, or just a little bit bigger than that. As it gets bigger than that, now we're talking about a tennis ball, or now even one of those mini basketballs. That's really big, right? So kind of we're looking at, for this procedure, we want to kind of have at least the tennis ball type size. And just for numbers wise, we usually talk about prostate in terms of grams. So 30 grams would be a normal prostate. And for this procedure, we're looking at usually about 50 grams and up.
Okay.
And there's no upper limit. We can do we've done as high as 600 grams, believe it or not. I mean, that's like almost like a woman with a pregnant uterus. It's that big.
Okay.
But that's the beauty of this procedure, is we can treat extremely large prostates.
Amazing. That's good information to hear. So as we're thinking about, as a patient, I've actually had the procedure, and I'm seeing the benefits over the last 6 months. I done it back in March, I believe.
About right. Yeah.
And so over time, what is the progression of the benefit from 6 months to 1 year to 3 years, whatever you've seen in your research?
Yeah, so usually people plateau somewhere. So, the improvement happens in the first 3 months mainly, right? And then at the 3 month to the 4 month mark, it tends to plateau out and it kind of stays level. And now there are going to be some times where it's going to be a little bit better and a little bit worse, but it usually comes back and it tends to stay pretty similar for, on average, about 5 years. Some people have, and for some people it lasts longer. We have some patients that are still doing well at 10 years after their procedure. And other patients, for some reasons, come back after 2 or 3 years and say it's starting to get bad again. In those circumstances, usually we can repeat the procedure and get them back to where they were. And so it's always a good opportunity when I find out about that. I can tell them that that's a possibility for them.
Okay, so with that information being said, are there other medications that you couple along with this procedure to increase the benefit?
Yeah, so there's a couple different types of medications you can take for BPH, for enlarged prostate. One of them makes the prostate softer. Another one shrinks the prostate a little bit. Our goal with this procedure is to try to allow men to not take any medications at all. We want them to be off their medications. But sometimes it is beneficial to add a medication on after the procedure. And the most common one, you may have heard it, it's Flomax. Most people have heard that one. And that makes the prostate softer. There's other ones like finasteride. You may have heard of that one. That shrinks the prostate. And then the last one that is pretty common right now is Cialis. Now, you might know Cialis for trouble with keeping an erection, but it also has the function of helping with urination. So depending on how a patient is doing, we can either have no medications after a PAE or add any of those that I mentioned in combination with one another.
Okay, so side effects
Yeah.
of the PAE and those medications.
Yeah.
What are some of the lesser known side effects that you would want people to know about through our conversation here today?
Yeah. So let's start with the PAE procedure side effects. Okay, the main ones that we tend to see. So first, let's talk about what we expect to happen. So there are certain side effects that we expect in the first few days after the procedure, and you may have experienced them. We expect an increased frequency of needing to urinate, a burning a little bit when you urinate, maybe urgency, like you have to go immediately, and those symptoms tend to last anywhere from the first 3 days to the first week. And then they settle down. So we expect all those. Other ones that we don't necessarily expect but tend to be pretty common are blood in the urine or blood in the stool. When I say pretty common, I don't mean everybody gets those, but about 10% of patients or so. And if that happens, it usually resolves on its own, so it's not something that needs to be treated. It's kind of a minor thing. There are other small things that can happen, like getting a collection of blood under the skin where we puncture the artery. That's pretty rare, but that's something that we can also treat here in the office. So those are kind of the main things that happen. The great thing about PAE, it has very little effect on sexual function, which is one of the differentiators from other procedures for the prostate. Now, when we talk about those medications you're asking about, there are side effects to those as well. For example, the most common one, which is called Flomax, or maybe you've heard the generic is tamsulosin is the generic name. That tends to cause things like lightheadedness or stuffy nose. It can also cause something called retrograde ejaculation. That's where when a male orgasm happens, the ejaculate goes backwards into the bladder instead of coming out. So some people call it dry ejaculation because nothing comes out, but that can also cause that. The finasteride has a lot of side effects. That's one that can get a little, I think it's a nasty med, but it inhibits the function of testosterone in some ways. So it can cause things like low libido or erectile dysfunction. In some men, it can even grow breast tissue. And you can imagine this is not something that men are really appreciating. The one thing that it actually does that may be helpful, and this applies to you in your profession, is it grows hair.
Correct.
Correct. So that's one thing that may be a positive. And the last one is Cialis, and that one really, it doesn't have much of a side effect profile. I mean, it helps with erectile dysfunction to a certain degree, and it also helps with BPH mildly, but it doesn't really have anything as far as that we know that's negative about it.
Okay, so thank you for that. And guess now, since you mentioned sexual function, a lot of people gonna want to know how is this going to affect my sex life?
Right.
Um, the benefits of BPH, or the negative side of BPH, is low libido, uh, low sperm count, all the things that come along with it. Once you have the prostate embolization
Mhm.
to combat the BPH, what are some of the benefits of a healthy sexual life?
Yeah. So a lot of the sexual side effects that we see associated with men who have enlarged prostates are actually due to the medications they're taking, not actually the enlarged prostate itself. So those medications that I just went through with those side effects, that's what leaves a lot of men struggling, either having low libido or having that retrograde ejaculation. And so one of our goals in doing the PAE is to get men off of those medications so that those side effects go away. And we see that in a lot of cases where once they stop taking the medications, their sexual function gets better.
Okay.
So the procedure itself doesn't actually improve sexual function, but allowing men to not take their BPH medications anymore does.
Okay. Excellent. Excellent. Diet. Are there any suggestions that you might have for good prostate health diet wise?
Yes, so what's been shown is really any diet that is a low inflammatory diet tends to work best for the prostate. The enlargement of the prostate tends to be a function of inflammation. We hear a lot about inflammation, kind of this systemic inflammation in our bodies that are affecting our arteries, our heart, all these things. It also affects our prostate. So the more inflammatory diet you eat tends to cause more prostate problems. Well, the next question is, what's an inflammatory diet? Well, I've heard there's a lot about this in the news lately. But basically, foods that are highly processed, a lot of fast foods, those type of things tend to cause a lot of inflammation in the body. So the more that you can eat a whole diet, which includes fruits and vegetables and grains and not things that have been highly processed, like unfortunately all the stuff that tastes really good, like McDonald's and Taco Bell and Chick-fil-A and all that stuff that we love, unfortunately falls into that highly processed category. So the more that you can avoid those type of foods, the better off you'll be with your prostate health.
And I know for a fact that most of us, time-wise, don't have the time to cook that well-balanced meal on a daily basis, but that is a part of the better overall health. Are there any other things that associate to your prostate health outside of diet, medication, and procedures that you can think of that would be beneficial for people to know from a medical standpoint?
Yeah. So they tend to be the things that are good for your prostate are the same things that are good for your overall body. So when we talk about, we kind of spoke about diet already. That was the first thing. So eating a more nutritious whole food diet without highly processed foods. The second one is exercise. So the more that you can keep yourself in shape, get regular exercise, whether it's weight training or cardio or running or biking or whatever it is, that's also going to be helpful for your prostate. Sleep, getting good sleep at night. So getting a good 7 to 8 hours of sleep each night, uninterrupted, is going to be helpful also for your prostate. And lastly, stress. Trying to maintain a low stress lifestyle. All those things reduce inflammation in your body and help your prostate to not be inflamed.
Amazing. And again, I really appreciate you taking the time out your busy day, because I know you running people in and out of here, making sure people are healthy. Before we wrap this up, are there any misnomers or just things that people might have contention about coming in for the PAE that you'd like to dispel?
I think a lot of people are scared when they come in, and that's understandable. It's a sensitive part of our body that we're talking about. The PAE tends to be relatively painless. There's not a lot of pain involved in the procedure, so that's one thing I try to really emphasize to everyone. And then the other thing I would say is that it's really important, if you are having urinary symptoms, to not wait. Because a lot of people say, oh, I'm going to do a procedure, when my urination gets really bad. Well, if you wait that long, it's really hard to get you better. So if you can treat it earlier, when it's just starting to happen, you have a much better chance of having good urination for the rest of your life.
Awesome, awesome. Dr. Isaacson, again, thank you for your
Yeah.
time. I'd like to give you the opportunity to let everyone know how you can be reached, where your clinic is, and your contact information
Yeah.
before we wrap this up.
Sure.
So if you
Yeah.
take a look in that camera
Yeah,
right there.
absolutely. Yeah, you bet. So my name is Dr. Ari Isaacson, and I work at IR Centers in Raleigh, and we're located in the Briar Creek area. And you can find us online at ircenters.com. That's IR, like interventional radiology, centers.com. And our phone number is 919-883-4601. And our email is also available on the web. So multiple ways to get a hold of us, and we'd love to talk to you.
Dr. Isaacson, thank you for your time. This is Jimmy Evans with Barbershop Therapy, where we cut through the problems with our honored guest, Dr. Ari Isaacson, and we'll see you on our next podcast.